Hi! We will talk about the pharmacokinetics of rectal route. First, let's define pharmacology. Pharmacology is the science of substances used to prevent, diagnose, and treat disease. It is subdivided into pharmacokinetics and pharmacodynamics. Pharmacokinetics is a branch of pharmacology which basically answers the question, what the body does to the drug. Pharmacodynamics, on the other hand, answers the question, what the drug does to the body. Overall, this allows us to understand the fate of drugs as it enters our body and elicit their response. Since we are dealing with pharmacokinetics of rectal route, let's have an overview of pharmacokinetic pathways. Absorption, distribution, metabolism, and elimination. Absorption is the transfer of drug from the site of administration to the bloodstream. Distribution is the process by which a drug reversibly leaves the bloodstream and enters the tissue. Metabolism, also known as biotransformation, is a process which converts drugs into non-toxic and polar metabolites. Elimination is the removal of a drug from the body. Generally, oral administration is the route of choice in the daily practice of pharmacotherapy. However, in some circumstances, this is impractical or even impossible. During nausea and vomiting or convulsions, in uncooperative patients, and even before surgery. In this case, rectal route is a practical alternative. Rectal administration uses the rectum as a route of medication and other fluids. Different medications are administered via this route. The most common is suppository, a drug delivery system inserted into rectum. An enema, a liquid solution injected into the rectum. A specialized catheter designed for rectal administration of medication and liquid that can be placed and remain comfortably in the rectum for repeated use. And the bulb syringe. So what are the advantages and disadvantages of rectal route? It is preferred an alternative for oral administration when vomiting or unconscious patients, uncooperative children, gastric irritants, higher concentrations achieved, reduced first pass effect. However, it is mostly uncomfortable, inconvenient to patients, absorption is slow and erratic, irritation or inflammation of rectal mucosa can occur. How are rectal drugs absorbed in the systemic circulation? Absorption of drugs. Drugs administered in rectal route is absorbed in the circulation by two portals, hepatic and systemic. This is the reason why rectal medications bypasses around 2/3 of the first pass effect via inferior and middle rectal vein, and only 1/3 is metabolized through the superior rectal vein. This means that drug will reach the system with significantly less alteration and greater concentrations. Although it is not 100% bioavailable compared to IV medications, rectal drugs have greater drug concentration in the systemic circulation than oral route. First pass effect, also known as pre-systemic metabolism. It is the phenomenon of a drug metabolism whereby the concentration of a drug is greatly reduced before it reaches the liver. Drugs may be transported via passive diffusion and active transport. In addition, blood perfusion, surface area, and contact time at the absorption surface and other factors greatly influences absorption. How are rectal drugs transported from the blood into different tissues? Distribution of drugs. As the drug is absorbed in the bloodstream, it leaves the circulation and enters the tissue. This process is affected by blood flow, capillary permeability, and protein binding. How are rectal drugs metabolized inside the body? Metabolism of drugs. Liver is the major site for drug metabolism. Phase 1. Introduce reactive and polar groups into the drugs, which makes them more active. Oxidation and reduction are the most common reaction. Phase 2. Converts active metabolites into a more polar and excretable form. Conjugation and glucuronidation are the most common reactions. How are rectal drugs eliminated from the body? Elimination of drugs. The major site of elimination is through the kidneys. Other pathways may include the excretion of drugs through the lungs and in bile, sweat, saliva, or body fluids. Overall, rectal route has relatively higher bioavailability, faster onset, shorter duration, and peak. As of this time, we have understood the fate of rectal drugs from the site of administration to different bodily tissues, and finally be metabolized and eliminated. In addition, important pharmacokinetic parameters are used. Bioavailability. The extent and rate at which the active rectal drug enters the systemic circulation, assessing site of action. Volume of distribution. Fluid volume required to contain amount of rectal drug present in the body at the same concentration as in the plasma. Clearance. The volume of the blood that can be freed of a specific constituent in a specified time by excretion into the urine through the kidneys. Half-life. Time required for a quantity to reduce to half of its initial value. So there you have it. The pharmacokinetic pathways of rectal drugs include absorption, distribution, metabolism, and elimination. Thanks for watching!